Well, it's about as regular as the winter season itself. We know it's going to come, but we just don't know how severe it's going to be. It, of course, is flu season. Well, from year to year, what we see are great variations in the nature of the influenza outbreaks. What do we mean when we say that these influenza seasons are fairly unpredictable? Well, there's great variation in the number of cases. Some years we have very few, some years very many. And there's also great variation in the severity of the disease. Some years we see lots of hospitalization and deaths, and other years the disease is much more mild, and we have fewer hospitalizations and fewer deaths. Now, what seems to correlate with more severe seasons? Well, we just have to look to the 24-25 influenza season, and we can get a glimpse. Now, there are different types of influenza virus, and there are different strains. The influenza virus we're most concerned with is Influenza A, and there can be different types of Influenza A. These are designated by given nomenclature: H3N2, H1N1, H5N1. The H stands for Hemagglutinin, and the N stands for neuraminidase. These are proteins on the surface of the virus, and they are essential in allowing the virus to attach to cells and then enter those cells. Remember, in order for a virus to replicate, it must attach and enter cells. So, the H3N2 viruses seem to correlate with much more widespread disease and more severe disease. All we have to do is really look back. All we have to do is really look back to the 24-25 influenza season. In the United States, we saw more hospitalizations due to influenza than we had in the 21st century. Indeed, you really have to go back fairly far to find another influenza season in the United States where there are more hospitalizations. Indeed, there were 127 hospitalizations per 100,000 people. That is hospitalization of 0.1% of the entire population of the United States due to influenza. So that is a very severe year. The H3N2 viruses originally emerged in 1968 with the pandemic, and they have been circulating in the human population ever since as seasonal influenzas. Now, possibly due to their relatively recent emergence, these tend to cause more serious disease. Now, what do we have circulating in the United States now? What we have circulating are H3N2 viruses. So, even early on, it was suggested that this would be a severe year. In the December 19th issue of the Journal of the American Medical Association, there was indeed this prediction. There is also another wrinkle that comes with this year's H3N2 virus, and that is that there was an emergence of a new grouping of H3N2 viruses called sub-clade K. Now, what is really a clade? It's basically a grouping in its common ancestor. But what we really need to know is that this sub-clade K has 10 signature mutations in the hemagglutinin subunit. The hemagglutinin and the neuraminidase are also going to be major targets for neutralizing antibodies. So, when we indeed see changes in the hemagglutinin and the neuraminidase, we are concerned that it's possible that our immune systems might find these viruses novel and have less experience with them and thus be less likely to neutralize them. Well, is that really the case this year? It doesn't seem to at the moment, but of course there is a concern. Every year, early in the year, various viruses are selected to be present in the influenza vaccine. The influenza vaccine, of course, is essential in protecting the community from widespread infection. What happened was the sub-clade K emerged after these viruses that would be present in the vaccine were selected. So we've got these 10 signature mutations in the hemagglutinin subunit, and these are not present in the vaccine. So will the vaccine protect us? Well, it appears it probably does. In children, it's protecting people about 70 to 75%. That is, there's a 70 to 75% reduction in hospitalizations of children so far. And in adults, it's much lower in the 30s. But while it's lower, it's not that much lower than the annual average. Another question, of course, will be how will antivirals protect against this new sub-clade K of the Influenza A virus? Well, right now it appears that all the antivirals are fully effective against the sub-clade K viruses. So, certainly strategies, if you haven't already, would be to get vaccinated. You are going to get some level of protection there. Now, of course, there's always someone that says, you know, I got vaccinated, I got influenza anyway. Well, that's always going to happen. No vaccine is going to be 100% effective. But it certainly will reduce the virological burden on society, and you could be one of the ones that get protected from it. But also, we do have these antivirals. These antivirals work better the sooner you take them, as drugs tend to do. And so what you're going to want to do is make sure that you're feeling well, and if you don't feel well, if you think you might have influenza, certainly see your healthcare provider. And that individual, if he or she can diagnose you with influenza, can certainly prescribe the appropriate medications. If you get them early, they will reduce the severity of the disease and the length of which you suffer from influenza. So, is it going to be a bad year? Very likely. We don't know when this is going to peak, but it is certainly ramping up quite quickly. Well, it's already January, but it's not too late to get vaccinated if you haven't. Also, there are the antiviral drugs. And so, again, as I said, be vigilant, look at your symptoms. If you think you've got influenza, go in early so that you can get the appropriate medications, and those medications will certainly help you out. Now, of course, I am not a physician. I have a PhD, but I am not a clinician, so anything in this video should not be taken as medical advice. If you are ill, you should certainly see a physician or healthcare provider that you trust, and that individual will provide you with the best advice and actions. This video, of course, is really just to provide information and entertainment. So thank you, and have a great night. Bye-bye.